So what we learned, it's a technique which is acceptable, it's safe. The patient have to go through an exacerbation valley, how I call that. But when you really pick out the patient based on the initial CT analysis, even using the heterogeneity index, you have a lot of patients which really having at the end the benefit of their technology. The problem, what we have to have in mind, we are creating an exacerbation. So exacerbation in CVD patient is highly correlated with mortality. So there is a balance between efficacy and safety for our patient. So can we have a signal by analyzing the data, avoiding morbidity and having still persistence efficacy? So balancing that. And also therefore, the company did really a well-designed and perfectly done analysis. They analyzed air-tissue ratio, how much air is in the treated lobe and how much tissue is in the treated lobe. And you see on that slide really that we can decrease the tissue mass after an InterVapor technology. And they also analyzed that tissue-air ratio regarding the adverse event. And what the company came up with that when you have a volume which is above 1.7 liters, then the probability that you will go through a high complication rate afterwards is dramatically increased than compared to a group which have less than 1.7 liters in that area. So even by an additional analysis of the CT scan, you can figure out, okay, this is the area we want to treat based on heterogeneity index, and based on the tissue-air ratio, this is the spot within that area where we can deliver the energy without having a lot of adverse event afterwards. So you see the data split up for that analysis, the 700 milliliter analysis, and you see when you really go in the specific subgroup above or below 700 milliliters, then you have different outcomes for the patients, really depending to that. And that means at the moment, the company changed their treatment plan in a way that the energy target should not exceed it to 700 milliliter, which gives you a high efficacy by a low risk for having severe complication. So summarizing my experience with the InterVapor technology, I think by doing a proper patient selection, we can find out with the help of the company and what the company offers you during developing the treatment plan, this is a candidate for the technology. Then we can apply the energy in an easy procedure. We have to accept that the patient have to have that exacerbation, but we know when the patient have an exacerbation, he will be the candidate who will show effects. So for me, phenotyping is the important issue. It can be done by the CT analysis, heterogeneity index, tissue-air ratio, and then we can offer the technique with a perfect safety profile and a high efficacy for our patients. And at the end, we as clinicians have an opportunity to help our end-stage patients improving their quality of life for the rest of their life.